Hi everybody, I am Lisa Bernaerts and I work as a clinical psychologist and systemic psychotherapist in the multidisciplinary pain center of the Antwerp University Hospital in Belgium. In this video, I will give you a short overview of the article More Than Just Pain, and I will describe a systemic compass for working with patients with chronic pain. Chronic pain is a major health issue that affects at least 10% of world's population. This means that approximately 60 million people experience pain on a daily basis. In our pain center, we treat and support patients based on a combined approach of medical interventions, psychotherapy, and physical rehabilitation. With this way of working, we follow the biopsychosocial model for treatment of chronic pain. This model states that biological, psychological, and social factors affect our pain perception. So we need to address all these three dimensions in understanding chronic pain. But we see that the social component of this model is often underreported. In this article, I will explain how pain poses a threat to the social self and how a pain experience challenges three interpersonal needs. For example, as human beings, we experience a need to belong. We all strive to have long-term positive and meaningful relationships, and being confronted with pain on a daily basis can have a large impact on this sense of belonging in various ways. Studies also show that feeling less social connection impacts our physical and psychological well-being as well as our pain experience. This connection between social inclusion and physical health is explained by the shared neurobiological pathways of social and physical pain. So feeling socially disconnected, excluded or stigmatized literally hurts. With this scientific basis in mind, I will describe how broad therapeutic conversations with people with chronic pain can be and how they cover far more ground than just their pain. Finding the right psychotherapeutic stance appears to be a careful work. Because pain is difficult to measure and largely invisible, people often feel as if their symptoms are imaginary. They seem to have to defend themselves against misunderstanding and disbeliefs, and this makes it challenging to discuss with patients the psychological factors that may affect how pain is experienced, as if this diminishes the realness of their pain. In this article, I explain how systemic theory inspires me to offer psychoeducation as a hypothesis and how a general attitude of not knowing forms a compass that allows us to attune to the patient and to not take up an advisory position. We examine the body as an autonomous entity by visualizing the broader connections, the history of the body, and all events that may have impacted it. By doing so, we address the complexity of the situation and we place the pain experience in a broad context of histories, experiences, thoughts, and emotions. In this way, the way of coping with pain becomes understandable in light of earlier experiences that people have lived. Their efforts are seen and acknowledged by talking about feelings of being hard on by. An experience has taught me that patients are very grateful for this. Systemic psychotherapy requires to keep in mind the identity transformation process that people dealing with chronic pain face and the influence of social interactions and structures on this quest. It is important to support patients in this search for a new identity. This process involves balancing between adapting to a changed body and trying to remain the old self as much as possible. This process of constant holding on and letting go requires change and adjustment, while people are still trying to remain themselves. This is a highly social negotiating process in which broader social rules of interaction and the dominant social discourse influence how a person is able and allowed to cope with their pain. While exploring these identity questions, we put patients back into a position with more agency. And it is supportive for me to work with the blind hypothesis that a person is better able to cope with pain when they are more than just their pain, when their identities are richer and more connections and influences are visible. I will illustrate the systemic concepts by introducing you to Eddy and Anne. They are both living with chronic pain and looking for ways of coexisting with the pain, and starting with their shared experience of chronic pain, we see two different living arrangements arising, two different generations, families, dreams, and desires. Thank you for your attention, and I hope you enjoy reading this article. Thank you.